Right, just bear with me, everyone. Let's see where we are. Okay. Okay, YouTube is live. Just bear with me, everyone. I'm just trying to.
I love your introduction. Wait till you see the introduction.
Let me just go public, and that's. We are on public, so
it's counting down.
Good evening in the UK and good afternoon in the United States of America. First of all, a bit of apology. I've got mixed up with the UK and American time. It's supposed to be not 6 o'clock, 7 o'clock UK's time. Also, another disclaimer. This is a live show, so there is no script. So if me and my colleague, they say something or misrepresent something, please forgive us in advance. We are human beings. Things can go wrong in live session. So that is my apologies in advance. Also, we will be trying to share it with the other UK podiatry forum. If that helps us, it would be getting more audience throughout. Today, we're going to talk about basically laser in nutshell and laser itself, how Remy can be beneficial, and pros and cons of any sort of laser treatment. So before I start the program, as I said, I've got colleagues of mine. If you want to make any comments, please do so on my Facebook, right? Not on the other Facebook I share the platform on. And as I said, today I have two special guests from the United States of America. Both of them are podiatrists, and I'm sure both of them within their field, their excellence in their field. So every one of you, welcome to our laser therapy show or information. And good afternoon and good evening to Dr. Amy and Dr. Zuckerman.
Hello, how are you?
Hello, everybody. I always enjoy doing these with you, Sumas.
Thank you very much. If Dr. Amy could introduce yourself and your background, and then I'll go to Dr. David.
Sure.
Sure. I'm originally from Brooklyn, New York, but I moved down to Miami to go to Barry University back in 1986. I graduated in 1990, and then I did a surgical residency in New Jersey, and then I came back to Miami. I currently have two practices, one in Aventura, Florida, and one in Davie, Florida. And I've been married for 27 years and I have two beautiful grown children.
You just had an anniversary.
Yes, I did.
Wow.
We went to Key Largo, 27.
Wow. Congratulations. I have congratulated you on Facebook before, but in person, congratulations.
Thank you so much. I appreciate
it. If Dr. David, if you could introduce yourself, please.
Yeah. My first name is David. I'm Dr. Zuckerman. I've been in practice. I'm retired now, but I practiced close to 40 years. I've been involved in the laser industry for close to 20 years. The Remy laser, which Dr. Amy actually has two of them. She's one of the first to ever use the Remy laser in the United States. One of the first. And it seems like it's been years, but it's been, I think you told me, Amy, about 2.5 years.
Correct.
The Remy laser was developed because I've been involved with almost all the laser companies, Kaiser Laser, Eltec. I was an owner of a company called Aspen, where we had like 20, 30 salespeople. But I woke up one day and I said to myself, we need to have a laser that not only is effective, it's got to be affordable to the patient, and it's got to be, as a physician or a podiatrist, you're entitled to make money. You can't spend $30,000, $40,000 on a laser, okay, and it could take you years. So the Remy, it's a first quality laser, believe me, but I don't have 20, 30 people working for me. I've cut the overhead down, and you always deal, if you're in the UK, you deal with Sumis, and in the United States, you deal with me directly. I train everybody personally, one-on-one. And that's important because I know as a podiatrist, I know what it's like in your practice every day. But it's also important. Uh, it's also important that you bring in experts or people that have had experience, and you need to talk to people who have used the Remy, and that's why we have Dr. Amy here today. She's going to tell you her experiences. She's going to talk about pain. She's going to talk about fungus toenails and warts. And you might want to briefly talk about, we're going to be starting, not right away. We base our things on evidence and testing. Everything with the Remy, it's all FDA cleared, but it's been tested. It's not something, we did studies, but the protocols on the Remy I've used for years. So Dr. Amy's going to talk about our initial testing and results, which are very interesting on spider veins as well. So without ado, I'm going to introduce Amy. Just tell us about, what you use the Remy for. I've actually been in your office too. So I think, to me, pain on musculoskeletal conditions is most important. I always call it pain in the ass. It's good for pain, inflammation, arthritis. So Amy, tell us your experience.
Right. So I use the Remy laser practically all day in my practice. It's made me excited about practicing podiatry. We use it for heel spurs, even after I do a cortisone injection. We use it for tendinitis, plantar fasciitis, fractures to increase bone healing. And what it is, it's a 10-minute procedure, and it feels wonderful on the patient because it feels warm. And you could even feel endorphins flowing through your body when the patient's undergoing this treatment. And they come back on a weekly basis. Some people even want to come back twice a week because they see such great results with it. And it's very affordable for the patients. I have patients that drive down an hour to get a treatment. Even people that have moved out of state, and they come back and they want to have the Remy laser treatment for pain because it works. It really works.
And that's most important. It has to work. That's the number one thing. And a lot of people, they talk about the evidence. There's level 1 evidence, means there's double-blind, randomized, placebo-controlled, multi-center studies. I have these studies on pain. If anybody wants to contact Sumis or myself, I'll show you the studies. So we're talking about there's evidence that's published, and there's evidence from personal experience. But the most important evidence are patients coming and demanding for it. That, to me, is the most important evidence. That controls your results. And as you've told us, Amy, patients are coming. That's exciting because patients don't really always, what patient comes to your practice and say, hey, doc, I can't wait to get that needle stuck into my foot.
And let me tell you something. I just thought of something else. People that had like tendinitis and something that was lingering, before I would refer them out for physical therapy. And then I would lose touch with the patient. Now everyone is maintained within my practice.
Absolutely.
And that's the beautiful part about this, that we work as partners together for the maximal improvement.
Yeah, and I agree with you. I mean, if you talk about physical therapy, I'm not saying physical therapy is bad, but you can keep a lot of your, I don't know, Sumis, in the UK, do you refer out the physical therapist, or do you mainly do physical therapy in your practice?
For me, like as I said, I've got a background in sports practitioner, so I try to keep everything within myself. Right.
Right.
I hardly refer to physical therapists because as a sports practitioner, most of the 70-80% of the job I can do it myself.
Yeah, and something I really got when you talk about sports medicine. I worked in the professional level. I worked for the Philadelphia Eagles, the New Jersey Devils, and I watched. I'll never forget, as long as I live. 15 years ago, one of the coaches for the Eagles said to me, "You're not experimenting on my." This is before lasers were really popular. You can't experiment with a laser on my players, and they finally grew used to it. I can't tell you how many careers I've changed. In fact, in the NBA, the Brooklyn Nets had the Remy laser in their locker room, treating Harding and Green. They lost by this much. It's a shame, but I don't know. Since you're from Brooklyn, I thought I'd mention that. Amy. I don't know if you like basketball, but that was a great series.
My son's
No,
basketball.
I know you love baseball. That I know. That I know. But the beauty of the Remy is it's multifunction. It just doesn't do one thing. It does pain, and pain is inflammation. Arthritis, plantar fasciitis, Achilles tendonitis, neuromas, hallux limbus, post-surgery.
Hi, Gaina. David Gaina Woodridge, one of our UK Remy user.
Yep.
Having such brilliant result from MSK patient. So good to see when other modalities have failed. I agree with Dr. Amy. So good to have a fabulous treatment available for patients with chronic pain now in the clinic. Thank you, Gaina.
Yes.
I'll tell you another thing that's helped me with the Remy so much is that I've gotten to meet new people, new doctors, and new interactions around the world, which has been pretty exciting for me because, with the internet, you have open conversations. And, my dream, and we just had this conversation today, lasers are just starting to be used for its inflammation, colitis, pericarditis, systemic autoimmune diseases. We're actually in development for that. It will happen. It's not if, it's a matter of when. It'll avoid a lot of surgeries. Musculoskeletal treatments are just the tip of the iceberg. I mean, inflammation causes a lot of diseases and a lot of problems. So we've talked about pain. And in Florida, people have fungus toenails.
Oh, do they? So I see that all day long. The laser is great. I actually do the laser and then I have them come back about 6 weeks later again to have them follow up, and I don't lose them doing their protocol because that's very important. I direct them on good foot hygiene, and I put them on a topical antifungal cream a lot of times, or this cuticle oil to nourish the nails and strengthen it. And I put them on biotin to make the nails grow faster. Because of course, everyone wants rapid results. And that's what we're getting now.
That is amazing.
That's my question to you, Dr. Amy. My problem is I'm struggling with fungal nail. So what is the protocol you are using currently?
Well, first I grind them down and then I bleach the nails with a nail bleach from one of our, it's called Lumera, and you leave it on for about 10 minutes and it bleaches it. And then I do the laser on it. And then I instruct the patient that they have to wear socks, and I have them put new socks on after the treatment, not the ones that they wore in, because it's just going backwards. And I put them on an antifungal cream that they have to use, and powder, and something for perspiration if need be.
So it's a combination.
It's a combination. And it's very important because that's where a lot of doctors are failing with the treatment.
That could be me.
Everybody says, well, I had the nail laser and nothing's working. And I said, well, did they tell you what to do after? And they're like, no.
I mean, the last presentation you did, it was called biotin. I remember you mentioned.
Yes.
What can you talk about that a little bit? I don't know if you have that in the UK, but it's for the health of the nail.
Biotin is a B vitamin. It makes the nails and the hair grow faster. Because we tell them it takes about a year for the nail to grow out, but this way it makes it go faster. So the new nail starts coming in clear, much faster. That way they don't get discouraged. And then I have them come back in about 6 weeks and I do the laser again.
How many treatments, how many nails do you think you've treated? And I mean, you do them every day. Is that you do more nails than I think you do pain? Am I correct about that?
I think it's about equal.
That's amazing. It seems like Florida and California. I just had a podiatrist purchase 3 additional Remy lasers, and he was very skeptical. And I didn't hear from him. 2 years ago, he bought one, and he just called me up last week. I need 3 more.
Oh, good for him.
And to me, that tells me you just don't buy 3 more lasers and it's okay. The results. It's got to be great. To me, pain is phenomenal. Fungus is tough. And that's why we're always working together. And that's the advantage we have. I bring on experts, people with experience. I want you to get good results. Sumis and I, we all want you to get good results. We're always refining. It's always a growing educational thing to get that edge. Winning is always inches, just a few little tweaking of things, and it's the difference between mediocrity and excellence.
Okay, one question to Dr. Amy again.
Yes.
I'm sure before you had the Remy, I'm sure you've seen other product or other laser in the market. What made you, first of all, to seek Remy? And is Remy, how are you finding the Remy?
I must have seen it in a podiatry magazine, but honestly, I can't remember. It must have been in a magazine, unless it was an email from David. I'm not really sure.
I think it was a magazine or an email. I don't remember. It's been
Right.
years.
And the wonderful thing is I had some issues getting to learn how to use it at the beginning, and David was wonderful. And once I mean, it's so simple. I was making it more complicated than what it is. It's very simple to use.
So do you have the Android system, or do you have our latest system, or do you have the old system?
Which, do I have the old one?
Yeah, the software. Amy does not have the Android system. She has the
We have now upgraded ourselves into cloud world. Right?
It's a little.
It's now we are technologically advanced. Right?
Okay.
We've got Android. Right? We've gone into Android for many benefits and many user-friendly wise, and the technology is there for us to use it. We are learning, we are improving like everything else, but we had to be head of the game. That's why I persuaded David that let's be the head of the game. Let's come with the technology.
Android. I was
Android. So
Android.
I think we are one of the Android user currently.
Yeah,
it
started in the UK, and I'm starting to bring it to the United States. We experimented with our colleagues in the UK, but I got to thank you, Sumis, because you really helped fine tune it. Now it's instantly boots up. He can upgrade his. Did you see the latest? You can upgrade your protocols every morning. You just press update like an iPhone, and it will bring in. It'll bring it in. Quicker, faster. I mean, I'm from the old school. I like to keep it real simple, but you convinced me to go Android, and I'm glad I did.
We had our hiccups, right? But
we did.
But without the hiccups, my driving instructor used to say, if you don't make mistake, why are you here for?
Yeah, but I'll tell you one thing, Amy, about it is that you do have to have good. Before you had to have great internet all the time. Now we have it. It's just the first time you need internet. If you don't have, and it just loads it down. It's not really in the cloud. It's stored in the cloud, but it goes right into the laser. It's the best. There's no Android like this before. People complain about Android because if the internet's off or you're in a bad area, if the programs won't come down. But now we've changed it where they come down once. But if you upgrade it, it has to be connected to the internet. It's like, we don't have 5G. Maybe someday we will have 5G with it. But it's
Gaino is asking, do I need to reboot the Remy? No, Gaino, I need your serial number so I can ask Karen to upgrade it for you, and then you just download it.
All I need is the serial number now. I can do it myself and go. I'll give you the you can do it yourself, Sumis. I'm going to give you the login. I have my own server now, and you log in and you'll just follow the directions.
Gaino, just give me a serial number whenever you're free, and I'll pass it to David, and then within a couple of days you'll get your upgrade.
Yeah. Yep.
There you go. That's how easy Android is. We upgrade.
It took me a long time. I mean, we worked on it for over 6 months, and I just was I like to keep things simple.
Right.
Simple. I haven't fully launched it in the United States, but I feel very comfortable doing it. It doesn't change the power. It's the same power, same wavelengths. One of the things that it really is helpful is that I have more powerful lasers that, you don't really need in podiatry, but I can add a wavelength to it just over the internet, put a wavelength in it, change it. I can do all of that, but the Remy, which is the Remy is the Remy, it's 4 pounds. It's powerful. This is plenty for podiatry. In fact, I remember this laser, they still use it. There's more 30-watt lasers out there for full body than any other laser around, except they used to be 50 pounds. I helped develop, it was the Aspen 30-watt dual, and excuse me, it wasn't dual, it was single wave. I think the 2 waves really made a difference.
Well,
And now we've gone into 3 waves, and you can run it at 60 watts because the 3 waves blend it and keep it cooler. But for full body, you don't need to have a 60-watt laser or even a 45-watt laser on a foot, unless you like gadgets. I like gadgets. I took my hand. I had
so we're trying to do hand-free treatment. Is going to be on experimental. So I've got the gadget today.
I love it. Love that.
I've got the gadget today. I'm going to experiment it soon with David, and we're going to see within a 3-4 months. I'll see the result.
It does work, but what we need to do is I want to see evidence-based treatments. You know, I'm not really. I don't like unattended, but it will be an option. You know, if people want it, they can get it. But to me, it's all about, and this is important, it's all about physical palpation. The way you know you get the right dosage. If you have fasciitis, you got to press on it.
Right.
When the pain is gone, you're done. It's not the time. It's when the pain goes away, which I can get rid of the pain in less than 5 minutes on the Remy.
So, again, Dr. Amy, do you do any wound management with laser?
Good question.
I do actually. I do.
Can you go into that for us?
Oh, it definitely works. If somebody has a wound, if they don't have neuropathy, or let's say it's a post-op on a biopsy and something that's just taking a little bit longer to heal, I'll run the probe around the periphery of the wounds, and I definitely see increase in the healing speed. Definitely.
Yeah. I don't know if you know, all therapy lasers were developed for therapy. They're originally the Remy, all of them, the class 4 lasers, even the lower level lasers were developed for therapy. In fact, there was a study done in the United States over 10 years ago. I'd love for people to read about it. It was diabetic, arterial, venous wounds, and you're talking the reduction in time and even difficult chronic wounds, how it healed. Lasers create neovascularization.
Are you using the surgical, anything to do surgery? Are you using the surgical tip for minor surgery?
I'm just using it for the warts.
Yeah, talk about that, how you do warts. I like that.
Well, there's 2 ways you can do it. You can just do it a non-surgical way, where you take the probe of it and you just keep needling the wart, right? And then, there we go.
Yeah.
And then there's another mode where it's more powerful, where I give them anesthesia, and I'm able to again probe it and then excise the wart from there, and it works great.
I recently took out pyogenic lesion just because I do electrosurgery, and this replaced the electrosurgery for me now, because that is, I believe laser is far safer than electrosurgery.
Well, it's definitely less pain, and you can coagulate bleeding at the same time.
Right.
You know,
so that's why I said, have you used for any minor surgical or lumps and bumps, anything like that?
No, I haven't.
Well, we should experiment on that as well.
Well, I'm a continuous student here.
Okay, but that's the future. I believe the surgical part of it, ingrowing toenails, minor surgical procedure. What electrosurgery can do, the Remy should do far better.
Well, definitely less pain. I'll tell you, when I was in my residency program, we used to make incisions with electrocautery.
Yeah.
Hip. And I'm not so sure. I'm just used to a 10 blade or a 15 blade when I make a surgical incision.
But there again, I seen the Remy on veterinary market that's solely used for surgical procedure.
Right.
Oh, really?
I have seen the Remy on veterinary market.
Oh, I have too.
Yeah, but they solely used for surgical procedure, lesion, cutting lesion, making surgical incision. Yeah. So therefore, there is a huge room in surgical pediatry.
Absolutely. It's been in the vet. I mean, the Remy does have a vet program in. In fact, Saturday, I was treating racehorses with the Remy, and wounds also. And they do in dentistry, they use the same type of probe where it'll cut away the gum, and it's much more effective than taking a blade because it cuts it, cauterizes it, and it also kills bacteria at the same time, which electrocautery does not. Electrocautery is burning.
Yeah.
Totally different.
But this is you're doing 4 or 5 things in one go. You antibacterial, right? Inflammation controlling. So you're doing your own procedure, cutting it, so coagulating it, reducing the pain. So you get it. That is the beauty about class 4 laser compared to electrosurgery. Electrosurgery, like you said, does one thing alone, which is good, by the way.
I'll tell you another thing, Simus, which people don't realize is if you buy a class 3B laser, a low-level laser, well, the Remy, you never can go higher with it. It's only low. With the Remy, you can go anywhere from 0.1, which is low,
To
medium.
30 watts.
It has a range. You can put almost any protocol you want in the Remy laser that you read about or talk about. And that is the beauty. I did that intentionally so you don't really outgrow the laser. If you're in a low-powered laser, I don't know, you can't go to a high-powered with it. You can do low, medium, and high with the Remy. You can change it. You can change the hertz, the timing, the time on, time off.
We talked about spider vein or something like that. Dr. David, did you, or is it Dr. Amy? Who was it saying that we?
Dr. Amy is going to be starting with this.
Yeah, David sent me. I said to him, why can't we do spider veins? People keep asking me all day long.
I've got the tips for it. I made the tips.
So he sent me this red tip, and I said, let me just try it on a patient that I know really well. There it is. So I did it on the pain setting because she came in for the pain laser anyway. I attached that, and just for 20 seconds on the vein by the medial ankle where all the veins are, it was like magic. The veins started disappearing.
But what setting is
magic.
it? Pain 25 setting you used?
20 seconds I did it.
Now, what was your wattage?
What was your setting protocol?
I think it was 20.
Yeah, it's 20 watts CW.
20 watt CW.
20.
I want to do a few more.
20, you just applied it for 20 seconds.
20 seconds, yes.
For 20 watt CW.
Correct.
So, okay, after the show is over, I need to find that.
Try it.
Simmons, we got to do this. When you say apply it, are you rubbing it over it or are you holding it in one spot?
No, it's rubbing it over it like a magic eraser.
Like this?
Not with the red tip, though. Not with the pain tip.
Okay, wait a minute. And you didn't use the little beak. You actually didn't change this part.
No, I used the red beak.
Okay, because I have okay, I have a beak too. The beak is this is 7 millimeters.
Yeah.
On this one, it's 7 millimeters. 6. If you move it in the 2 position, it's 6.5. And if you move it in the 1 position, this is a zoom. I don't know if you knew this. You can actually move this in the various numbers. It goes down to 6. If you use the beak, which I have to go get, I don't have it in front of me, it's 1 millimeter. So it seems like this is better.
So did you use the beak one for spider vein?
The beak.
Beak, okay. Yeah. So you just applied it like this.
Yes.
Let me get the beak.
Like an eraser.
Yeah. Okay, fantastic. As I said, I need to find out because we are playing around. Somehow I couldn't get it. Why is not working? Because I am following somebody else's protocol. Either protocol is too low, right?
How are you doing it?
I am using those it's very low, 4 watts setting.
Oh, okay.
That's the literature. That's what the literature
Yeah,
shows.
that's the literature. I'm using what the literature is saying, but it's absolutely not working well.
Go higher. Mine was a little too high. I think I have to lower it a little because it started heating up too much.
Yeah, use
It
your
made the
finger.
veins go away, though.
So this is what you
Oh,
use.
there's the beak.
Yeah.
Use
That's
your.
the one.
You know what I would do is I would rub it like a eraser, but I would feel it to see if it's not getting too warm. Okay, we're putting this on.
So
this
and instantly reduced. Did you find out that instantly reduced?
Oh, absolutely.
Okay.
How am I doing?
We only got, time is flying so good because we're just getting excited. We only got 1 minute left.
Okay.
Amy, would you say this is correct? This speed?
I was doing it faster than that. Like erasing it. Like that.
Okay. I would also keep cold ice or cold water if it gets too warm. Put ice on it. That's they use that a lot in when they're doing it with spider veins, even when they're in, they use ice or cold water if it gets too warm. Or there's no reason why you can't stop.
Anyway, thank you for both of you. It's been, see how quickly when you
My
really enjoy the show, and when you get to the excited moment, it's like part 2 coming up, right? So you wait for continuous, so people get glued into it, the drama, and suddenly drama finished. That's what we're doing today. We are just trying to get excited about spider vein. We'll continue next session. So anything you want to say before we go, Dr. Amy or Dr. David?
No, it's a pleasure to be here today. Don't hesitate to purchase your Remy. It's wonderful.
It is. It's more than I ever expected. And Sumis, we will talk about the unintended. I have the protocols. I'll show you.
Just once I am off, then I will come back to our thing. Again, people or practitioner throughout the world who's watching it, again, apology for my time, because UK time, American time is different. So my colleagues, both of them are from USA. So it was supposed to be 6 o'clock in the UK time. No, it's meant 7 o'clock, right? So I apologize for that. But again, we will have new program coming up very soon. Probably, David, we need to teach them tip by tip what each tip does in future. So watch out how the protocol are set, how treatment is done by tip by tip. Thank you very much. And thank you for everybody watching our show. And hopefully we shall see you in the future. Good evening and goodbye.
Good night.
Thank you. Bye-bye.
Bye-bye.